Hello, my name is Chantel Bima. I'm a nursing student at Lincoln Tech. I'm going to show you how to do a medication administration pass. I'm going to follow the 6 rights of drug administration. And when I do that, I'm going to check for the right patient. And when I'm checking for the right patient, I'm going to look at the chart, the order, and it says Nancy Delvecchio. I'm going to check that. And then I'm going to check on the patient order correlate, and they'll make sure that's the right patient. Then I'm going to take a look at the drug. The drug I'm going to be passing today is the generic name is carvedilol and the brand name is Coreg. So I'm going to look on the medication sheet, the MAR, against the patient order, and if you look here, you'll see that it says a generic name, carvedilol. And on the medication sheet, says that as well. So now we're going to check for the right dosing. What I have here, the dose that I have is 25 milligrams. And the patient order is also 25 milligrams. So just in case I had to convert, I had my calculator there. And also, so the next right, I'm gonna make sure I confirm is the right route. And the route on this paper, on the medication administration sheet, says PO. PO stands for per oral, so that's with your mouth. And then the right time. On this medication sheet, and I'm comparing it also to the patient order, the right time says 2 times a day. After the 5th right is the 6th right. So that's when you give the medication. As soon as you give the medication to the patient, you see that the patient has taken the medication orally. I would document that on knock, knock, knock.
Come on in.
Oh, thank you. Hi, my name is Chantel. I'm going to be your nurse for today. Even though I know who you are, but I'm going to have to ask you a couple questions, your name and date of birth, just to ensure I'm giving the right med to the right patient. Can you please tell me your full first name and last name, please?
Nancy Deficiency,
And then your date of birth.
December 4th, 1946.
Thank you. Since I verified who you are, I'm here to give you your blood pressure medication. It's the carvedilol, or the brand name is Coreg. So before I do that, I have to do an assessment on you to check your blood pressure and your apical pressure, your apical pulse. Before I do that, I want to wash my hands. I'm going to wash my hands, starting by turning on the water, taking some soap, putting it in my hands, and then washing in between my hands for 15 seconds. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. Okay, so I take a napkin, I dry my hands, then I get another napkin and turn off the sink. Now I'm heading back over to my patient to do the physical assessment of her blood pressure and apical pulse. I'm going to assess my patient's blood pressure, so I'm going to start with my blood pressure cuff. This is what I'm going to use to put around Mrs. Delvecchio's arm. And this is the stethoscope. I'm going to be using the diaphragm to listen to see at her brachial pulse to see the systolic, diastolic blood pressure. Miss Delvecchio, so before I go ahead and take your blood pressure, I just want to know, Is there anything that, like, any devices that you have in your left arm that will prevent me from actually getting a reading on your blood pressure?
No, just my right. I have an AV fistula in my right.
Okay, thank you. That's good information to know, but I just need your left arm. Thanks. I have my blood pressure cuff on my patient. She has her arm extended. It's right on the brachial artery, which I'm gonna assess. So what I'm gonna need my patient to do is put her arm down so it can rest. So I can get a sitting blood pressure. I'm gonna take my diaphragm and put it on her brachial artery. So I can assess her blood pressure. And her blood pressure is 120/80 in a normal range. So now I'm going to assess your apical pulse using my stethoscope. I'm going to clean it with the alcohol. This is Delvecchio's apical pulse, and that's located at the left fifth intercostal space. You're going to find it in the midclavicular line. And so what I'm going to do, down, and a normal pulse, apical pulse, is between 60 to 100 beats. So I'm going to count for a full minute to assess Mrs. Delvecchio's pulse, apical pulse. And a full minute is 60 seconds. 18, 19, 20, 21. And I'm checking against my watch. Her pulse rate is 88 beats per minute. Now I'm going to assess my patient's blood sugar levels. I'm going to do a blood glucose on the patient as well. It's about 7:30 right now. Breakfast is going to be in 30 minutes. Since we are doing the AM medication and the patient hasn't eaten yet, I want to do a fasting blood glucose on the patient. I'm going to ask Miss Delvecchio what finger works best for her when it comes to the blood glucose stick. And she's showing me the finger that she would like me to use. My hands are already clean and sanitized, and I have on gloves. So what I'm going to do, I'm going to tell Miss Delvecchio she can rest her hand on this table. I have the glucometer, which is going to do the reading. So before I take her finger and use a lancet to get the blood for the reading, I want to take an alcohol swab and clean the patient's finger before I stick her with the lancet. Take, please. Gonna take the lancet and squeeze, inject. As the blood's coming out, I'm gonna wipe away the first blood, and then I'm gonna take my strip that's in the glucometer, and the blood is you're gonna see the blood coming onto the strip, and then I'm gonna wait for the reading. So as I squeezed the blood and got the read on the glucometer, I noticed that the patient's blood sugar level is at 180. So I'm going to write that down. Miss Delvecchio, now that I've gotten all your assessments needed, I want to start passing your meds. So before I do that, I want to do my medication checks, starting with the first medication check. So now I'm going to do the first check for the medication, and when I'm doing the check for the medication, I have to make sure I have the right patient, the right drug, right dose, right route, right time, and at the end is the right documentation that I gave the patient the med. So what I'm going to be checking against on the first med check is check the health the order from the professional, like the doctor, I'm gonna call it the HCP order, the healthcare professional order against the pharmacy label. And so this is my pharmacy label for the med, the carvedilol, that's the generic name for the high blood pressure medication, the Coreg. And so what I'm going to do is on a pharmacy label, it will have the patient's first name and last name, which is like the same thing that's on this medication administration record. The patient's name is Nancy Delvecchio. And so then now you can look at the date of birth as well. And a lot of times they have it, well, they do have it on the pharmacy label. Also, I'm going to go ahead and check the right drug, and the name of the drug, the generic name, says carvedilol, and that's on the medication sheet, and that's also on the pharmacy label. I'm gonna go ahead and see the right dose, which is the 25 milligrams, and that's also 25 milligrams on the pharmacy label. Also the right route, it's orally per oral. The right time, it says 2 times a day. So 2 times a day can be like breakfast or dinner. And also at the end, the documentation. So, but earlier in the video, you saw that when I took the blood pressure, I documented how much the blood pressure is and also the fasting glucose. So that's the first check. The second check, I'm going to check the pharmacy label against the med sheet. So hypothetically, well, not hypothetically, this is the med sheet. So what I'm going to do, I'm going to do another check again and go through the same rights. The right patient, which is Nancy Delvecchio, and then I'm going to look on the pharmacy label as well, see the patient's name, see if it's the right drug, the carvedilol, and then I'm going to go ahead and see if what the dose is, if it's the right dose, if the dose is matched, 25 milligrams. The route is orally. The time is 2 times a day, breakfast or dinner. We're going to be doing this one for breakfast time, and then the documentation. So now I'm going to get ready to prepare my medication. Now I'm going to take my medication and pour it into my medication cup. This is my medication, and I'm going to pour a tablet into my medication cup. Hypothetically, this is my medication cup, and the tablet is inside. So what I'm going to do now is, since I already poured the medication in the pill, the tablet is inside of the medication cup. What I'm going to do is I'm going to remove my gloves, and then I'm going to sanitize my hands with the hand sanitizer. And then my next step is I am going to go enter the patient's room. I'm going to hand sanitize my hands now with the hand sanitizer before I enter the patient's room. So I donned my gloves, and I'm providing privacy for my patient to make sure the patient matches the person who is on the MAR. And so I'm going to come into the room, which I'm already here, and just ask the patient her name to verify her name and her date of birth against the medication administration record. I already know your name, but can you please tell me your full name again, your first name and last name?
Nancy Delvecchio.
Thank you. And your date of birth?
December 4th, 1946.
Thank you. So, I see the bracelet on your arm. what I want to do is also identify that to make sure it matches. I know the patient already told me their name and the date of birth verbally, but I just want to go ahead and match it against the medication sheet. And I see that it matches. Nancy Del Vecchio, and it says 12/4/46. Okay, thank you for that information. So I'm going to go ahead now and do the third check of the medication before I administer it to the patient. And when I do that, I'm going to check the 6 rights while I'm at the bedside. And the 6 rights, which I'm going to go ahead and check against the medication sheet, is the patient's name, right patient, the right drug, the right dose, which is the 25 milligrams, the right drug, which is the carvedilol. It's on the medication sheet. That's what I'm looking at. And the right route, which is orally, the right time, which is breakfast 2 times a day, breakfast or dinner, so it's 2 times a day, and we're going to do it now. And then at the end, it's going to be right documentation. So when I give the patient the med and I see her take it, I have to document and sign my name along the time that I gave her. Give her her high blood pressure medication. I want to let her know to look for any adverse signs or side effects, lightheadedness, dizziness, when she stands up, to make sure she calls a nurse. Use her call light to call a nurse before even getting up anyways. I want to let her know that she should always take her medication, the carvedilol, with her breakfast meal or dinner meal, but right now it's breakfast, so I just want the patient to know she should take it with her meal, and if she should look out for signs of lightheadedness and dizziness is when she's standing. Make sure she uses the call light to call the nurse. Miss Del Vecchio, I just wanted to make sure that I assessed your swallowing. I have my gloves on and gonna give the patient the medication. Put it in her hand so she can take it. So I gave the patient the medication in her hand, but usually what you can do is just give the patient the medication cup with the pill inside of it, so the patient can administer it. I have gloves on, so I wanted the patient to have the medication in her hand, and I'm going to hand her some water so she can go ahead and take the medication as I watch. Okay, go ahead and show the patient swallow her meds and just looking to see if there's any meds. Can you please? Okay. Gonna remove my gloves now and wash my hands, and then I'm gonna go and document the fact that I gave the patient her medication. So on the medication sheet, I signed my full signature at the bottom on the LPN signature line, and then I initialed at the time the medication was given. So you're going to see also that I documented the blood pressure and the apical pressure as well. So everything is documented here for the initial med. Now I'm on to administer the insulin, the regular Novolin insulin, to my patient. What I'm going to do before I do that is I have to wash my hands because I already finished with the first med. So I'm going to wash my hands to move on to the second med. As stated earlier, I took her blood glucose at 7:30. The blood glucose was 180. So now I have to get the insulin to administer to the patient. And on the medication sheet, since the patient's blood glucose is 180, I have to give 2 units of insulin. So what I'm going to do is I'm going to start preparing that. So now I'm going to don my gloves, and I'm going to go ahead and read the order for the insulin and do my checks. And so I'm reading the healthcare professional, the order against the pharmacy label. And so the Novolin is here. I'm going to check for the right patient, which is Nancy Del Vecchio. I also see that Nancy Del Vecchio. The right drug is the Novolin Regula. The right dose is total is 100 units. 100 units. Right route is subcutaneously, and so she can get the medication with her meal. So I did her blood glucose at 7:30. So that's the right time. It's about to be 8 o'clock. When I administer it, I'm going to document the fact that I gave the patient the medication on the medication sheet to see if the patient has any allergies. Like I checked earlier, the patient didn't have any allergies to the carvedilol. Now I also have to check if the patient has any allergies to insulin, and it's documented here. No known allergies, NKA. That means no known allergies. So the right patient is Nancy Del Vecchio. Right drug is the Novolin Regula. The right dose is total is 100 units in this syringe, insulin syringe, but she's going to take 2 units because of her blood sugar being 180. The right time, she's going to take it at breakfast time, which is going to be around 8 o'clock. And then when I document it, that's going to be the right documentation, the fact that she took the meds. So now I'm going to prepare my medication to administer to my patient. And so what I'm going to look for now is I'm going to get an insulin syringe. And the gauge has to be a 29-inch gauge. I need to get the regular insulin. And what I need to check is there's some things I need to check on this medication. I need to check the expiration date. It says it expires in 2025. And the open date, which would be today, which is 12/14/2021. And it can stay open for 28 days. Before I clean the vial, I'm going to roll the insulin. Then I'm going to take my alcohol prep and do a clean 360, clean around the soft part where I inject the needle in, like so. And discard of the alcohol swab. So what I'm gonna do is, before I do anything, I'm gonna draw up 2 units of air into the needle before I even do anything with the vial. I'm gonna get 2 units of air into the needle. And once I have the 2 units of air into the needle, into the syringe, I'm gonna take that syringe at a 90-degree angle, insert it into the vial, and then I'm gonna put in the 2 units of air before I draw up the 2 units of insulin. Once I do that, I am gonna label the syringe with the type of insulin that's in it and the date, and I'm gonna initial it. Now I'm gonna remove my gloves and sanitize my hands. Walk into the patient's room. I'm washing my hands. As I'm in the patient's room, I'm going to provide privacy for the patient. Checking the name to make sure the names match. Okay. So I have my gloves on now. And before I give the insulin to the patient, even though I know she is, I'm going to do my third med check. And I'm going to identify the 6 rights in the third med check. I just want to make sure I have the right patient and matching it along with the insulin vial. So I'm going to go ahead and look at the medication sheet and compare it with the pharmacy order. So the name of the patient and match it with the pharmacy label. And the patient's name is Nancy Delvecchio. The right drug is Novolin R, that's regular, and that's Novolin R regular. The right dose is, it's going to be, I'm going to give the patients 2 units because the patient's blood sugar was, her blood glucose, I meant to say, was 180. So if you look at the medication administration sheet, if a patient has a fasting blood glucose of 180 or 150 and above, I have to give 2 units. In total, regular insulin has 100 units, but out of those units, the 100 units, I'm only going to give 2. And the right route is subcutaneously. And so I'm going to compare that. And then the right time, which is about to be breakfast, and the patient, she's starting to eat pretty soon. I'm going to be giving the patient the medication while she's eating. The right time, that's the right time. So it's going to be around 8 because I took the fasting blood sugars 30 minutes before the time for the injection. And then after I give the medication, I'm going to document the fact that I gave it on the med sheet. Before I give the patient the med, I'm going to give her patient teaching so she can know like the signs and symptoms and what to look out for when she takes insulin and how it's supposed to work for her. So, Ms. Delvecchio, I just want to let you know that when you're taking this regular insulin, it's supposed to control, you're taking it to control your blood glucose levels. And you're supposed to take this when you eat. You're supposed to take this when you eat. And as soon as you eat, when you take the insulin, you're going to notice that it's going to start to work for you. But I want you to look out for signs and symptoms of hypoglycemia. And that's when your blood glucose level is low. And you're going to exhibit signs of irritability, fatigue, sweating, confusion, shaking, headaches. You might have trouble concentrating. So that's some of the symptoms of hypoglycemia, and then people can die from that. So I want to be sure that you're eating before I actually give you the insulin, so you won't experience the signs and symptoms of hypoglycemia. But then there's also hyperglycemia, where your blood glucose is too high, and that's when you're going to see extreme thirst, dry mouth, weakness, headache, and frequent urination. Some of this medication, I just want you to be mindful to make sure that you eat something. Only reason why I took your fasting blood glucose is because I want to know your blood glucose levels when you're not eating. So the insulin is supposed to help take in the glucose to break it down and use it for energy. So, Ms. Delvecchio, so I'm going to get ready to give you your insulin injection. First, I want to know, where do you usually administer your insulin?
Well,
What site?
When I give myself my injections, I do it to my stomach because it's easier to see.
Okay, so I just wanted to let you know that you have to rotate your sites. So another good place you can do is at the back of your arm. It has a lot of subcutaneous tissue there, and you can just inject it into the back of your arms. So I like how you already have the abdomen, so that's great.
Mm-hmm.
And then so you can do the back of your arm as well. So that's another site you can do, and then the interior part of the thigh as well.
Mm-hmm.
So try to look for the fatty parts. So I'm going to start by cleaning the site on the back of the patient's arm. I have my gloves that's already donned, and I'm going to clean the site with the alcohol swab for me to give the injection of insulin. And so there's two ways to insert this needle. For people who are skinnier, we will do a 45-degree angle. That's more like like slanted. But for my patient, she has more tissue here that I could use to just do my 90-degree angle. Hold the back of the arm with my non-dominant hand, and I'm gonna take the insulin syringe and inject it at a 90-degree angle that's going straight in, and then make sure I press down on the plunger so the insulin is delivered to the patient. Remove. So the syringe is going to retract, and when it retracts, I'm going to go ahead and dispose of it in my sharps container. And that's a place where we put needles, and so we won't make a mistake and have any needle sticks. So I'm just going to assess the area to make sure there's no blood coming from the site, because if there was, I would just like wipe it and apply a Band-Aid to this area. I removed my gloves after disposing of the syringe in the sharps container. After removing my gloves, I washed my hands. And now it's time for me to document the fact that I gave my patient, Nancy Del Vecchio, her Novolin, the regular. I gave it to her at 8 o'clock. So I'm going to document the fact that I did that. I'm going to document my initials because my signature is already at the bottom from the med that I gave earlier to my patient. I already have her blood glucose that I documented earlier, which is 180, the 2 units. And now I'm going to put my initials.